I need to tell you something that's going to sound almost unbelievable. That plain white box of baking soda sitting forgotten in your kitchen cabinet? It might be the most underrated health solution you've been overlooking your entire life. I discovered this by accident when my 84-year-old father was struggling with multiple health issues, and what happened next shocked even his doctors. Stay with me until the end, because the final application I'm going to share completely transformed my father's quality of life when nothing else worked. This isn't some miracle cure marketing. This is ancient wisdom backed by modern science that Big Pharma doesn't want becoming common knowledge. Hidden power. What if I told you that one of the most powerful health allies for seniors has been sitting in your kitchen cabinet all along? Something so simple yet so effective that it sounds almost too good to be true. That's exactly what happened when I discovered the profound impact baking soda had on my father's health journey. I remember watching him shuffle around the house, wincing with every movement, popping prescription pills that seemed to create more problems than they solved. The side effects were brutal: stomach issues, dizziness, fatigue. It was heartbreaking seeing this once vibrant man who used to build furniture from scratch and dance with my mother in the kitchen, reduced to someone who could barely make it to the bathroom without assistance. That's when I fell down a research rabbit hole that changed everything. I wasn't looking for miracles, just something, anything, that might offer some relief without the cascade of side effects. What I discovered about simple, ordinary baking soda left me stunned. Not because it was some extraordinary revelation, it wasn't, but because something so effective, so accessible, and so affordable had been hidden in plain sight all these years. Sodium bicarbonate, the scientific name for baking soda, creates an alkaline environment that can profoundly impact numerous bodily functions. I'm not talking about some pseudoscientific claim. I'm talking about basic chemistry that happens in your body every single day. Your body naturally works to maintain a delicate pH balance, and as we age, that balance becomes harder to maintain. The result? Inflammation skyrockets, digestion suffers, and a cascade of health problems follows. Truth revealed. Here's what they don't tell you. Chronic low-grade acidosis, a condition where your body's pH becomes slightly too acidic, is increasingly common as we age. It's not severe enough to send you to the emergency room, but it's just enough to make your body struggle day in and day out, creating a perfect storm for developing chronic health issues. Modern diets loaded with processed foods, decreased kidney function as we age, certain medications, chronic stress, all of these push our bodies toward greater acidity. And in that acidic environment, inflammation thrives, digestion falters, and cells struggle to perform their basic functions. It's like trying to grow a garden in soil that's all wrong. Nothing thrives the way it should. But here's where baking soda enters the picture. At its most fundamental level, baking soda helps neutralize excess acid in the body. It's the same principle that makes it work for heartburn, but the implications go far beyond occasional indigestion. When your body isn't constantly fighting to restore proper pH balance, it can redirect that energy toward healing, regeneration, and proper function. I remember the skepticism in my father's eyes when I first suggested we try something so simple. Baking soda? Like what your mother used in cookies? He asked with that look that said he thought I'd finally lost my mind. But at that point, what did we have to lose? He was taking 7 different medications, each with its own constellation of side effects, and still suffering daily. We started small, just a quarter teaspoon in a full glass of water once a day. Within 3 days, he mentioned that his chronic heartburn seemed better. Within a week, the persistent joint pain in his hands had noticeably diminished. By the 2-week mark, his energy had improved enough that he actually suggested taking a short walk around the neighborhood, something he hadn't done in over 8 months. Was it a miracle? No. Was it the beginning of a profound transformation? Absolutely. Inflammation fighter. Let's talk about inflammation, the silent fire burning inside so many aging bodies. Chronic inflammation isn't just about occasional aches and pains. It's a fundamental driver behind most age-related diseases. Heart disease, arthritis, diabetes, cognitive decline all have strong links to chronic inflammation. What many people don't realize is that an acidic internal environment can perpetuate and worsen this inflammation. It's a vicious cycle. Acidosis promotes inflammation. Inflammation creates waste products that increase acidity, and the cycle continues. Breaking this cycle becomes increasingly important as we age and our body's natural buffering systems become less efficient. When my father started his baking soda regimen, we noticed something remarkable happening. The persistent redness and swelling around his finger joints, a visual manifestation of the inflammation within, began to subside. The knuckles that had been so swollen he couldn't wear his wedding ring for years gradually returned to a more normal appearance. I want to be absolutely clear. Baking soda is not directly treating arthritis or any specific condition. What it's doing is helping to restore a more balanced internal environment where your body can better manage inflammation on its own. It's supporting your body's innate healing capabilities rather than overriding them like so many medications do. A 2018 study published in the Journal of Immunology found that baking soda appears to signal to mesothelial cells, cells that line body cavities, to tell inflammatory cells to stand down. In simpler terms, it seems to help calm the immune system's inflammatory response. This isn't about suppressing your immune system, it's about helping it function more appropriately. For seniors dealing with the pain and limitation of inflammatory conditions, this natural approach can be life-changing. My father described it as feeling like someone turned down the volume on the pain. Not gone completely, but reduced to a level where life became enjoyable again rather than something to be endured. Digestion revolution. As we age, digestive issues become increasingly common and increasingly troublesome. Acid reflux, indigestion, bloating, irregular bowel movements, these aren't just inconveniences. They significantly impact quality of life and can lead to serious nutritional deficiencies over time. Many seniors find themselves taking antacids and acid blockers regularly, often unaware that long-term use of these medications can create new problems, including reduced absorption of essential nutrients like vitamin B12, calcium, magnesium, and iron. Nutrients already challenging to absorb as we age. Baking soda offers a different approach. Rather than blocking acid production, which is actually necessary for proper digestion, it neutralizes excess acid, helping to restore balance. It's like the difference between damming a river, blocking acid, and managing its flow to prevent flooding, neutralizing excess. My father had been taking prescription acid blockers for years. His doctor had warned him about the potential for nutrient deficiencies, but the alternative, constant burning pain in his chest and throat, seemed worse. When we began the baking soda regimen, we didn't immediately stop his medication, but over time, under his doctor's supervision, he was able to reduce the dosage and eventually transition to using baking soda as needed. The transformation went beyond just acid reflux. His chronic constipation, a side effect of both age and multiple medications, began to resolve. His appetite improved as meals were no longer followed by discomfort. And most surprisingly to him, the persistent bitter taste he'd complained about for years gradually disappeared. For many seniors, digestive health is the foundation upon which overall well-being is built. When digestion improves, nutrient absorption improves. When nutrient absorption improves, cellular function improves. And when cellular function improves, everything from energy levels to cognitive function can benefit. One simple approach we found effective was a small pinch of baking soda in a glass of water after meals. Not enough to neutralize the stomach acid needed for digestion, but just enough to take the edge off and prevent the acid from creeping up where it doesn't belong. Kidney support. One of the most fascinating and least known benefits of carefully administered baking soda relates to kidney health, something of particular concern for many seniors. As we age, kidney function naturally declines. By age 70, many people have lost 30 to 40% of their kidney function compared to what they had in their 30s. This decline isn't just a number on a lab test, it has real consequences. The kidneys play a crucial role in maintaining proper pH balance in the body. When they can't efficiently remove acid from the bloodstream The body compensates by pulling calcium from bones, and ammonium production increases, both of which can have negative long-term effects. In fact, metabolic acidosis, a condition of excess acidity, is common in the elderly and even more common in those with reduced kidney function. This chronic acid load forces the body to compensate in ways that, over time, can accelerate bone loss, muscle wasting, and further kidney damage. This is where baking soda enters the picture in a truly remarkable way. Clinical studies, actual peer-reviewed medical research, have shown that sodium bicarbonate supplementation can help slow the progression of chronic kidney disease. A study published in the Journal of the American Society of Nephrology found that patients with chronic kidney disease who took sodium bicarbonate were significantly less likely to experience rapid progression of their disease, develop end-stage renal disease, or require dialysis. When I shared this research with my father's nephrologist, I expected skepticism. Instead, he nodded knowingly. "We've been using bicarbonate therapy in nephrology for years," he explained. "It's actually standard care for certain kidney conditions. The challenge is finding the right balance for each individual." That last part is crucial, and why I'm not suggesting anyone start self-medicating with baking soda for kidney disease. The appropriate use of sodium bicarbonate for kidney support should be monitored by healthcare providers with regular blood tests to ensure proper dosing. But what struck me most was realizing that something so established in medical practice, something with legitimate clinical evidence behind it, remained virtually unknown to the general public. It highlighted the disconnect between medical knowledge and public awareness, a gap that often leaves people suffering unnecessarily. Joint relief. The pain of arthritis and joint inflammation affects approximately 49% of all adults over 65. Nearly half of all seniors wake up each morning to stiffness, aching, and limited mobility. For many, this pain defines what they can and cannot do each day, whether they can play with grandchildren, garden, or even simply dress themselves without assistance. When my father first noticed improvement in his joint pain, I was cautiously optimistic but skeptical. Could something as simple as baking soda really make a difference with a condition as complex as arthritis? I needed to understand the mechanism, how this might actually be working. What I discovered makes perfect sense from a physiological perspective. The connection between acidosis and joint pain is well established in medical literature. An overly acidic environment can increase inflammation in the joints and even accelerate cartilage breakdown. By helping to neutralize this excess acid, baking soda may create conditions where inflammation naturally subsides and the body's healing processes can function more effectively. There's also emerging research suggesting that sodium bicarbonate may help regulate the activity of mesothelial cells, which line our body cavities, including joint spaces. These cells help control local inflammation and immune response. A study from the Medical College of Georgia found that drinking baking soda appears to tell these cells to signal to inflammatory cells that the environment is normal, helping to reduce unnecessary inflammatory responses. For my father, the difference was substantial enough that he began referring to his morning glass of water with baking soda as his movement medicine. The stiffness that had made mornings an ordeal of slow, painful movement gradually gave way to more comfortable mobility. Not perfect, he still had arthritis after all, but improved enough that he could once again engage in activities that brought him joy. He explained it best one morning as we sat on the porch watching the sunrise. "It's not that the pain is gone completely, it's that it stepped back from center stage. It's no longer the main character in my day." For many seniors, that shift, from pain as the dominating force in life to pain as a manageable background condition, makes all the difference in quality of life. Urinary health. Urinary tract infections, UTIs, become increasingly common as we age, affecting up to 10% of men and 20% of women over 65 at any given time. For seniors, these infections aren't just uncomfortable, they can quickly become dangerous, leading to confusion, falls, and even sepsis if left untreated. The rise in UTI frequency among seniors stems from multiple factors: anatomical changes, decreased immune function, and often an increasingly alkaline urine pH that creates a friendly environment for bacterial growth. This is where baking soda's effects become particularly interesting. While we often discuss baking soda's ability to alkalize the body, its effects on urinary pH can be more nuanced. For some people with highly acidic urine, small amounts of baking soda can help bring urinary pH to a more neutral level, around 6.5 to 7.0, which is actually less hospitable to many common UTI-causing bacteria than either strongly acidic or strongly alkaline environments. My Aunt Margaret had suffered from recurrent UTIs for years. After 3 serious infections requiring hospitalization, her doctor had put her on a low-dose preventative antibiotic, something that concerned all of us due to the risk of developing antibiotic resistance and disrupting gut flora. When I shared what we'd learned about baking soda with her, she consulted her urologist, who was open to trying a more natural approach under supervision. They developed a protocol, a 1/4 teaspoon of baking soda in a full glass of water each morning, along with regular pH testing using simple urine test strips to ensure her levels stayed in the optimal range. The results were remarkable. In the year before starting this protocol, she'd had 5 confirmed UTIs. In the year following, she had just 1, and that occurred during a week when she'd been traveling and had stopped her baking soda routine. Her urologist was intrigued enough to begin suggesting similar protocols to other patients with recurrent UTIs who were looking for preventative approaches. It's not about replacing appropriate medical treatment for active infections, he explained. It's about creating an environment where infections are less likely to take hold in the first place. This proactive approach, addressing the conditions that allow problems to develop rather than just treating problems after they occur, represents a fundamental shift in how we think about health. It's a shift from reactive to preventative medicine, and it's particularly valuable for seniors who may be more vulnerable to infections and less resilient when infections do occur. Mental clarity. One of the most unexpected benefits my father experienced, and one I've since heard echoed by many others, was an improvement in mental clarity. The brain fog that had become his constant companion began to lift, and the sharp wit that had defined him throughout his life started to resurface. This cognitive improvement initially seemed unrelated to the baking soda regimen. How could something so simple possibly affect brain function? But as I dug deeper into the research, compelling connections emerged. The brain is extraordinarily sensitive to pH changes. Even slight shifts toward increased acidity can impair cognitive function through multiple mechanisms. Acidosis can reduce oxygen delivery to brain tissue, impair glucose metabolism, the brain's primary fuel source, and increase oxidative stress, all factors that can contribute to cognitive impairment. Additionally, the chronic low-grade inflammation associated with acidosis doesn't stop at the blood-brain barrier. Neuroinflammation is increasingly recognized as a contributor to age-related cognitive decline and various neurodegenerative conditions. By helping to restore proper pH balance and potentially reducing systemic inflammation, baking soda may create conditions more favorable for optimal brain function. It's not directly treating or preventing any neurological condition, but it may be removing impediments that prevent the brain from functioning at its best. Dr. Robert Perlstein, a neurologist I consulted about these observations, offered this perspective. Many of the medications we use for conditions like dementia work by addressing specific neurotransmitter deficiencies or protein accumulations. But we're increasingly recognizing that brain health is also profoundly affected by the overall metabolic environment. Oxygen availability, glucose utilization, inflammatory status, and yes, pH balance. Supporting foundational aspects of brain metabolism might not be as targeted as our pharmaceutical approaches, but it may create conditions where the brain can better maintain its own health. For my father, this translated to more engaged conversations, improved memory for day-to-day details, and a return of his interest in crossword puzzles, a hobby he had abandoned as too frustrating when words and clues that once came easily began to elude him. Energy restoration. Fatigue is one of the most common complaints among seniors, often dismissed as an inevitable part of aging. But what if some of that fatigue isn't actually about age at all? but about an internal environment that's making cellular energy production more difficult than it needs to be. Mitochondria, the powerhouses within our cells that generate ATP, the energy currency of life, function optimally within specific pH ranges. When the body becomes even slightly too acidic, mitochondrial efficiency decreases. It's like trying to run a precision engine with the wrong type of fuel. It might still work, but not nearly as well as it could. Within weeks of beginning his baking soda regimen, my father noticed a gradual but unmistakable increase in his energy levels. Not the jittery artificial energy that comes from stimulants, but a steadier, more sustainable sense of vitality that allowed him to re-engage with life. I didn't realize how tired I'd gotten, he told me one afternoon as we finished a mile-long walk, something that would have been unthinkable months earlier. I thought it was just getting old, but now I wonder how much of it was just chemistry. That insight, the recognition that what we often attribute to just aging might actually be addressable imbalances, represents a profound shift in perspective. It moves us from resignation to agency, from accepting decline as inevitable to recognizing that some aspects of that decline might be optional. The energy improvement many seniors experience with regular appropriate use of baking soda likely stems from multiple factors: improved mitochondrial function in a more optimal pH environment, reduced inflammation that no longer diverts energy to unnecessary immune responses, better oxygenation of tissues, improved digestion and nutrient absorption, and potentially better sleep quality as physical discomfort diminishes. Whatever the precise mechanisms, the result is the same: a return of vitality that many had assumed was permanently lost to the passage of time. Skin renewal. The skin tells a story as we age, a story written in wrinkles, age spots, dryness, and various inflammatory conditions that become increasingly common in our later years. While baking soda can't reverse the clock or erase decades of sun exposure, its beneficial effects on the body's internal environment often manifest visibly on our largest organ, the skin. My father never cared much about his appearance. He was the type who considered chapstick fancy and owned exactly one bottle of aftershave that had lasted him 20 years. But even he noticed the changes in his skin after several months on the baking soda regimen. The persistent redness and flaking that had plagued his face and scalp for years, a condition his dermatologist had diagnosed as seborrheic dermatitis, had dramatically improved. When we mentioned this unexpected benefit during his next checkup, his doctor wasn't entirely surprised. Inflammatory skin conditions often reflect internal inflammatory states, she explained. If you're reducing systemic inflammation, it makes sense that you'd see improvements in inflammatory skin conditions as well. Beyond addressing specific skin conditions, many seniors report a general improvement in skin quality with regular, appropriate use of baking soda. Skin appears more hydrated, with better color and tone. Some of this likely stems from improved circulation and oxygenation of tissues that comes with better pH balance. Additionally, baking soda can be used externally as part of a skincare routine, though this requires careful approach. A dilute solution, about 1 teaspoon to a cup of water, can serve as a gentle exfoliant, removing dead skin cells and allowing better absorption of moisturizers. This same solution can provide relief from itchy skin, a common complaint among seniors as skin becomes drier with age. My father, emboldened by his success with internal use, eventually agreed to try a baking soda paste mixed with just enough water to form a spreadable consistency on particularly rough patches of skin on his elbows and heels. The results convinced even him of its value: smooth skin where calloused, cracked areas had persisted for years, despite various commercial creams and lotions. The dual approach, addressing the internal environment that affects skin health from within, while also using baking soda thoughtfully as part of external skincare, offers a comprehensive strategy for skin health that many seniors find remarkably effective. Sleep quality. The relationship between pH balance and sleep quality represents one of the most underappreciated connections in health, particularly for seniors who often struggle with insomnia and disrupted sleep patterns. The science behind this connection is fascinating and multifaceted. Our bodies normally become slightly more alkaline during deep sleep, It's part of the natural circadian rhythm of pH fluctuation. When chronic low-grade acidosis disrupts this pattern, sleep quality can suffer. Additionally, excess acidity increases sensitivity to pain, and pain is one of the most common disruptors of sleep among seniors. My father's sleep transformation wasn't immediate, but about 3 weeks into his baking soda regimen, he mentioned something striking. "I realized this morning that I didn't get up to use the bathroom last night, not once." For a man in his 80s who had been making 3 to 4 nightly trips to the bathroom for years, this represented a significant change. As the weeks progressed, his sleep continued to improve. He began sleeping for longer uninterrupted periods, waking feeling more refreshed, and even occasionally reporting dreams, something he hadn't mentioned in years. Sleep specialists confirm that dream recall often indicates better REM sleep, a crucial phase for cognitive health. The mechanisms behind these improvements likely include reduced inflammation and thus reduced pain, better regulation of acid-base balance throughout the night, and potentially improved function of the glymphatic system, the brain's cleanup mechanism that operates primarily during deep sleep and works best in a properly balanced pH environment. For many seniors, better sleep represents one of the most immediately impactful benefits of a balanced internal environment. Sleep affects everything from cognitive function to immune response, from mood to motor coordination. When sleep improves, nearly every aspect of health and quality of life improves alongside it. One approach that proved particularly effective for my father was taking a small amount of baking soda, 1 to 8 teaspoons, in water about an hour before bedtime, in addition to his morning dose. This timing seemed to help establish the optimal environment for quality sleep. However, sensitivity to sodium bicarbonate's effects varies widely among individuals, and some people find that taking it too close to bedtime actually energizes them. So personal experimentation, preferably with healthcare provider guidance, is essential. Dental defense. The mouth often reveals the first signs of aging: receding gums, increased sensitivity, dry mouth, and greater susceptibility to cavities and periodontal disease. These changes aren't merely cosmetic. They can profoundly impact nutrition, social confidence, and overall health. The connection between oral health and systemic health grows clearer with each passing year of research. Periodontal disease has been linked to heart disease, stroke, diabetes complications, and even certain neurodegenerative conditions. For seniors, maintaining oral health isn't just about keeping their natural teeth, it's about protecting their entire body. Baking soda has been used in oral care for generations, and modern research confirms its multiple benefits. It effectively neutralizes acids that can damage enamel, reduces the adhesion of plaque-forming bacteria to tooth surfaces, and helps maintain a healthier oral microbiome by preventing overgrowth of acid-producing bacteria. My father had struggled with increasing tooth sensitivity and bleeding gums despite diligent brushing and regular dental visits. His dentist had recommended specialized and expensive toothpastes and rinses, which helped somewhat but never fully resolved the issues.